Every strange twinge in your abdomen, every sudden wave of exhaustion, every unusual craving could be a sign that your body is in the middle of a life-threatening medical emergency. Or it could be the very first whisper of the most profound and beautiful new beginning of your life. Welcome. Today, we're navigating that confusing, anxious, and hopeful space of early pregnancy. This isn't just a checklist of symptoms. This is a guide to understanding the language your body is speaking, from the subtle hints to the urgent warnings you absolutely must not ignore. We're going to move from suspicion to certainty, and from anxiety to empowerment. The moment a pregnancy begins, your body undergoes a revolution. It's a silent, massive overhaul orchestrated by a flood of hormones, all designed to create a life-sustaining environment. This isn't a random collection of symptoms. It's a unified, systemic response. So, let's break down the classic clues, the ones that are so common they're considered the cardinal signs of this incredible transformation. First, and most famously, is the missed period. Medically, it's called amenorrhea, and it's the most obvious flag for many. A powerful hormone with a long name, human chorionic gonadotropin, or HCG, essentially puts your monthly cycle on pause. It tells your body, hold on, we're building something here. Don't shed the uterine lining. But remember, while it's the most common sign, it's not foolproof. Stress, diet, intense exercise, and other medical conditions can also press that pause button. Next up is the infamous morning sickness. This is a terrible name for it because, as millions can attest, it can strike morning, noon, or night. For some, it's a mild, nagging queasiness. For about half of all pregnant people, it's full-blown nausea and vomiting. This is your body's reaction to that same surge in HCG and other hormones. While it feels awful, it's generally a sign that the hormonal foundation of your pregnancy is strong. Then, there's the fatigue. And we're not talking about your average, I need a coffee tiredness. This is a profound, bone-deep exhaustion. This is primarily driven by a massive increase in the hormone progesterone. Progesterone is the pregnancy-sustaining hormone, but it also has a sedative effect. At the same time, your body is working overtime, building a brand new organ, the placenta, and increasing your blood volume by up to 50%. It's no wonder you feel like you could sleep for a week straight. And finally, we have breast changes. As early as 1 or 2 weeks after conception, you might notice your breasts feel tender, swollen, or heavy, often like an intensified version of pre-period soreness. Your areolas might darken and enlarge, and you might see tiny bumps appear on them. This is all your body, guided by estrogen and progesterone, getting the mammary glands ready for their future job of lactation. These are the big four, but the story doesn't end there. Other, more subtle signs can appear, like light implantation spotting or mild cramping as the embryo settles into its new home. You might feel bloated and constipated, thanks to progesterone slowing down your entire digestive system. You might also develop a superhero-like sense of smell, or a bizarre metallic taste in your mouth. All of this is part of the body's incredible, and sometimes strange, response to creating a new life. The Great Imposter, PMS versus pregnancy. Now we arrive at one of the most frustrating sources of confusion. Is it PMS or is it pregnancy? The symptoms, bloating, breast tenderness, mood swings, fatigue, can look almost identical. The reason for this overlap is simple: the hormone progesterone. In a normal cycle, progesterone rises after ovulation to prepare your uterus for a potential pregnancy. This is what causes PMS. If no pregnancy occurs, progesterone levels plummet, your period starts, and the symptoms vanish. But if you are pregnant, progesterone levels don't fall, they keep rising. So, how do you tell the difference? The single most important clue is the trajectory of the symptoms. PMS symptoms are cyclical. They build up and then disappear when your period starts. Pregnancy symptoms, on the other hand, are progressive. They arrive, they stick around, and they often get more intense. Think about it this way. PMS cramping is usually more intense and resolves as your period begins. Early pregnancy cramping is often milder, like little twinges or pulls, and it can persist. PMS breast tenderness goes away. Pregnancy breast tenderness sticks around and often gets worse. And while you might crave chocolate with PMS, you probably won't develop a sudden, intense hatred for the smell of coffee. Strong food aversions are a classic pregnancy sign that are very rare in PMS. And of course, there are the true differentiators: a missed period, persistent nausea, and those specific changes to your nipples are almost exclusively signs of pregnancy. From guesswork to certainty, the power of testing. Symptom watching can only take you so far. For a real answer, you need an objective test. The first step for most is a home pregnancy test. These little devices are scientific marvels that detect the presence of the HCG hormone in your urine. For the best results, wait until the first day of your missed period and use your first morning urine, which is the most concentrated. A positive result, even a faint line, is almost certainly correct. A negative result, however, isn't as final. If you test too early, the HCG levels might be too low to detect. If your period still doesn't show up, wait a few days and test again. Once you have a positive home test, it's time for clinical confirmation. A blood test is the gold standard. It can detect HCG earlier and at lower levels than a urine test. More importantly, a quantitative blood test, or beta HCG, doesn't just give you a yes or no. It tells you the exact amount of HCG in your blood. By taking 2 of these tests, 48 to 72 hours apart, your doctor can see if the levels are doubling appropriately. This is one of the very first ways to check if the pregnancy is developing healthily. Finally, there's the ultrasound. Usually done between 6 and 8 weeks, this is the moment of ultimate confirmation. The ultrasound confirms the pregnancy is in the right place, inside the uterus. And, most beautifully, it allows you to see the tiny flicker of the fetal heartbeat, the most certain sign of a viable, developing new life. Red flags. When to sound the alarm. Okay, we need to pause here and talk about something incredibly important. While most of these early symptoms are normal, some are signs of serious, life-threatening complications. Normalizing discomfort in early pregnancy is common, but it can also be dangerous. You must know the difference between a benign symptom and an urgent warning sign. The first is a potential miscarriage. The most common sign is vaginal bleeding, which can range from brown spotting to heavy, bright red bleeding with clots. This is often accompanied by cramping that can feel like a period or be much more severe. If you are pregnant and you experience any bleeding, you need to call your healthcare provider immediately. If the bleeding is heavy, soaking more than 1 pad an hour, or if you pass tissue, you need urgent medical attention. The second is an ectopic pregnancy, and this is a true medical emergency. This happens when the fertilized egg implants outside the uterus, usually in a fallopian tube. It cannot survive, and if it's not treated, the tube can rupture, causing life-threatening internal bleeding. The classic signs of an ectopic pregnancy are 1. Persistent pain, usually sharp and localized to one side of your lower abdomen. 2. Abnormal vaginal bleeding, often watery and dark brown. 3. And this is the one I need you to remember: shoulder tip pain. This is a sharp, specific pain felt exactly where your shoulder ends and your arm begins. This is not a pulled muscle. It is referred pain from internal bleeding irritating your diaphragm. If you feel this pain, it is a massive red flag that a rupture may be happening. If you have these symptoms, especially shoulder tip pain, or if you suddenly feel extremely dizzy, faint, or look pale, this is a life or death emergency. Call 999 or your local emergency number immediately. Other red flags to watch for include a fever over 100.4 degrees, 38 degrees, severe headaches with vision changes, painful urination, or extreme swelling in your hands and face. Never dismiss these symptoms. Your life and your health are too important. Once you've confirmed your pregnancy and you're confident you're not experiencing any urgent warning signs, you get to take the next exciting step: scheduling your first prenatal visit. This appointment, usually held between the 7th and 8th week, is the longest and most comprehensive one you'll have. It's the cornerstone of your entire pregnancy journey. Your doctor will take a detailed medical history, perform a physical exam, and order a panel of blood and urine tests. They'll perform an ultrasound to confirm your due date and check for that beautiful little heartbeat. But most importantly, this visit is about education and partnership. It's your chance to ask every question you have. Your provider will discuss nutrition, medications, and lifestyle changes. They will give you a roadmap for the months ahead. This is the moment where the burden of interpreting every symptom on your own is lifted. You are no longer alone in this. You now have an expert team dedicated to supporting you, reducing your anxiety, and ensuring the safest, healthiest journey possible. The early days of pregnancy are a whirlwind of change, a complex dance of hormones, symptoms, and emotions. By learning to listen to your body, understanding the difference between the normal discomforts of creation and the urgent signs of complication, you move from a place of uncertainty to